A coating on the back of the tongue can cause bad breath. Bad breath, also called halitosis, is generally caused by a buildup of bacteria or debris inside the mouth. For some people, this odor-causing buildup occurs on the back portion of the tongue. However, it is not always clear why this tongue buildup occurs. Possible causes of tongue-based bad breath may be due to postnasal mucus dripping from the nose to the throat, which forms a whitish coating. This coating often contains many different forms of bacteria which may thrive on the tongue's rough surface and cause unpleasant odors in the mouth. The back portion of the tongue is especially susceptible to bacterial overgrowth, as this area is relatively dry. The lack of saliva combined with the tongue's natural grooves and fissures can trap food particles, dead cells, and mucus from the nasal cavities. As a result, this environment can quickly become a medium for bacterial growth. According to Dr. Harold Katz, nearly 90% of endogenous bad breath that is not caused by digestive upsets or metabolic diseases like diabetes is actually due to noxious bacterial buildup on your tongue. Tongue bacteria demonstrate a distinctive, smelly odor because of volatile sulfuric compounds and polyamines. This coating can develop on the back of your tongue even if you otherwise practice good oral hygiene, especially in individuals with allergies or certain infections like thrush. Although most people brush their teeth daily and floss, few are aware that it is just as essential to clean your tongue as it is to clean your teeth and gums. To combat bad breath from your tongue, look at your tongue in the mirror to see if it has a coating or an unusual white color. If you notice anything suspicious, see your healthcare provider, as he or she can treat any illness involving chronic postnasal drip that may be causing a bacterial coating. Also, make sure to visit your dentist for regular cleanings and exams and to maintain a good oral hygiene routine of brushing your teeth and tongue, flossing, and rinsing with an antibacterial mouthwash every day. Benefits of living a healthy lifestyle. Health issues like bad breath, also known as halitosis, can be easily prevented by maintaining a healthy lifestyle. For maximum health and to combat oral odor, try implementing healthy habits in areas such as oral hygiene, diet, and routine medical care. Oral hygiene is extremely important for preventing bad breath and ensuring a healthy mouth. If you do not brush and floss your teeth daily, food particles can accumulate in your mouth, increasing bacterial growth and causing an unpleasant odor. Odor-causing bacteria and other debris can also lead to bad breath when dental appliances like braces or dentures are not cleaned properly. When oral hygiene is not properly maintained, gum disease and other health concerns can result and may damage the gums and jawbone. Daily oral hygiene requires brushing your teeth, tongue, and gums after meals, flossing at least once a day, and rinsing with an antimicrobial mouthwash. Dietary habits also affect your breath. By maintaining a healthy diet of fruits, whole grains, vegetables, and lean protein, you can combat bad breath and ensure better physical well-being. Pungent foods like onions and garlic should be avoided, as the volatile substances in these foods can contribute to bad breath. Avoid sticky, sugary, and acidic foods and beverages, as these lead to tooth decay and other odor-causing oral issues. Additionally, drink plenty of water to ensure healthy saliva production, since saliva is responsible for cleansing the mouth from bits of food residue. If you smoke or consume excessive amounts of alcohol, consider changing your lifestyle, as these habits are highly detrimental to your oral health and your well-being. Daily exercise is also important to control weight and to reduce your risk of breath-busting illnesses like diabetes. Finally, scheduling routine medical checkups with your doctor and dentist is essential for continued health. Visit your dentist at least twice a year for cleanings and oral exams, and see your doctor for well checks and other health concerns. Being proactive in pursuing a healthy lifestyle is an important foundation for reduced bad breath, improved physical health, and long-term well-being. Eating healthy food contributes to eliminating bad breath. What you eat affects how your breath smells when you exhale. This is because as food is digested, it is absorbed into your bloodstream, and remnants are eventually released by your lungs when you breathe. Most people are aware that eating pungent foods and alcoholic drinks can cause short-term bad breath. Regularly consuming foods such as garlic, onions, fish, and strong spices can lead to chronic bad breath and body odor. In addition, sugary foods serve as the primary nutrient source for odor-causing oral bacteria. By ingesting sugary foods frequently, you are enabling bacteria to produce acid that contributes to tooth decay and causes an unpleasant odor. Acidic food and drink are also primary factors of tooth erosion and bad breath. And finally, unhealthy processed foods can hinder the liver's detoxification process and release smelly byproducts into the bloodstream, which are then also exhaled through the lungs. To alleviate bad breath, try snacking on raw carrots, celery, or apple slices. Watery fruits and vegetables can help clear your mouth of odor-causing debris. Drinking plenty of water will also reduce pungent breath odors. Additionally, limit the amount of sugary foods and drinks that you consume, especially if you will not be able to brush your teeth immediately afterward. When taking liquid or chewable medicines, opt for sugar-free medicines, as these do not leave sugary deposits in the mouth. Reduce the amount of acid that comes into contact with your teeth by avoiding high amounts of carbonated drinks and fruit juices. Also, try to drink acidic drinks quickly and avoid swishing them around in your mouth for any period of time. For long-term oral health and reduced bad breath, make sure you thoroughly clean your teeth within an hour of eating or drinking anything, especially if your meal included pungent, acidic, or sugary foods and drinks. Although this may not completely prevent bad breath, it can help reduce its severity when performed regularly and efficiently. If you think certain foods may be causing your bad breath, it is often helpful to keep a log of the food you eat and bring it to your dentist for him or her to review. Which doctors may treat bad breath? For those who suffer from chronic bad breath, also known as halitosis, a home oral care routine may not be enough to combat odor. Even if you are maintaining an effective oral hygiene routine of brushing your teeth, tongue, and gums and flossing after every meal or snack, you may still be experiencing bad breath. If this is the case, you should see a doctor or a dentist. According to the Academy of General Dentistry, over 90% of bad breath cases are linked to issues in the mouth, throat, and tonsils. As a result, seeing a dentist is often the wisest option to treat chronic bad breath. Your dentist can perform regular cleanings and exams, and he or she can also conduct further tests to ascertain what parts of your mouth are contributing to bad breath. Generally, your dentist is able to treat the causes of your bad breath. If he or she determines that your mouth is healthy and not responsible for bad breath, your dentist may refer you to your family doctor or to a specialist for treatment. Alternatively, another illness such as diabetes, cancer, or a respiratory infection can lead to symptoms involving bad breath. For cases like these, you should see your primary healthcare provider to diagnose and treat these underlying causes of unpleasant oral odor. Sometimes medications are to blame for causing bad breath. If you suspect this may be the case, ask your prescribing physician if the medication can be adjusted or if he or she can suggest other options. Bad breath in infants or young children may indicate an infection or an undiagnosed medical issue. In these cases, consult your child's pediatrician or dentist as soon as possible. For adults and children, taking proper care of your teeth and visiting the dentist at least twice a year are the simplest ways to avoid bad breath and other oral health concerns. Thank you for watching. Don't forget to subscribe.